So now let's turn now to a little bit more about some of the U.S. focused epidemiology and the real costs and burdens of RSV disease. And we'll start again with a comparison between children and adults, because there is a difference there. Sarah, can you get into some of the numbers for us?
Absolutely. And I think one of the first things people think about when you hear RSV is, again, our babies. And for me personally, my 6-month-old son, we spent 2 nights in the hospital with RSV under a tent and breathing treatments and watching the breathing that was super scary. But I think here's the important part. Usually with young children under the age of 5, there's about 60 to 80,000 hospitalizations a year. When you look at our older adults over the age of 65, it's double that. And this is even with a pretty inadequate testing, in my opinion. And so you're seeing double the hospitalizations in our elderly population. And then you're also seeing exponentially more deaths. The death rate for RSV in adults over the age of 65 is pretty on par with influenza. You're looking at anywhere from 13 to 15,000 deaths annually. And again, that's in the cases that we know are attributed to RSV. And so this is a very significant illness, and there's a big burden on our elderly population.
There's the toll on the individual patient, but I also think about their families, and I think about society too, because RSV is associated with a high amount of cost overall. For the kids, it's more focused on, again, absenteeism from school and work. It's associated with more clinic visits and hospitalizations. But for older adults, it's a different story. There's actually a pretty big cost on the back end, even after the infection is over. Do one of you feel comfortable addressing that?
Yeah, studies do show that the sort of lasting effects, not named long RSV, but thought of that way, with long-lasting fatigue, lowered energy, decreased social functioning. This has all been shown in well-done studies. And the mortality rate 1 year post-hospitalization is much greater than it is for influenza. Now, that's all cause. It could be from cardiac reasons or exacerbation of their chronic lung disease or something like that. But it really does have an impact on society that has been underreported and underrecognized.
And even the cost of hospitalization is greater. These folks with RSV are staying, when they are hospitalized, they're staying longer than our adults with influenza, with COVID-19, and they end up more often in intensive care. They end up more often using oxygen. They're more often placed on ventilators, and so then you have that cost aspect to the patient. But then also you think of the burden on the family. There's a burden on the healthcare workers and these respiratory units who are then caring for these family members. We all remember just the horrifying videos during the COVID-19 pandemic. And so these are things that we can still, that still happen, and things that we can hopefully prevent.
And it's unfortunately when they're hospitalized, they, with low blood pressures, they develop acute kidney injury. They have a COPD exacerbation, a secondary pneumonia. And so it really opens up the door, particularly for more frail patients. And you can have frail patients. They don't have to be 78 or 89 years old. I have very frail 42-year-olds because of all their comorbid illnesses. And so when they're discharged from the hospital weeks later, they are much weaker, as you said. So they require rehab over a couple months. And then remember that those insults to the kidneys, to the lungs, to the heart, all of them add up, and it leads to more problems requiring more interventions, more specialists, more care. And if you look at the healthcare dollars, particularly among older adults, those 60 and over, the average healthcare costs associated with an RSV hospitalization are in the tens of thousands more than if they had not been hospitalized. So there's the personal costs, and I think that's what I always focus on as a clinician. But there's also significant societal costs as well, because we always want to be good stewards of our resources. And so, again, thinking about that ounce of prevention with a vaccine versus paying, potentially all this morbidity, mortality, all these dollars lost. I think the choice is very simple and clear, and I think patients can really understand that when it's put in those terms.
Absolutely. And I think it's another illness that's going to cause absenteeism from work. And so you take these folks who are between the ages of 60 and 67 before they can get Medicare supplements. If they don't have insurance and they're working, we have a huge opioid epidemic just like the rest of the country here. And so we have grandparents raising their grandkids. And so there are folks in this age group that are working in a lot of the factories and even big places of employment here. If you miss so many days, then you have to have FMLA or you get points taken away on your attendance. And so there's penalties for missing work. And so when you have COVID, when you have influenza, and now RSV, well, we've always had RSV. It's just one more way that they could potentially miss work and miss a paycheck and get in trouble with their employment.
Well, I think that is a great jumping off point for our next section where we're going to talk about special populations. I think some of the most vulnerable populations. So these are individuals who are living in assisted living, and these are individuals who don't have access to quality care because there is a gap. And I think that there's no doubt that RSV has a disproportionate burden on these individuals. So look forward to that discussion here shortly.